Hi, everyone. My name is Nneka. I am a fourth year medical student at the University of Texas at Austin, also getting a master's degree in biomedical engineering. And I wanted to talk to you today about the use of artificial intelligence for vitiligo and how you can use it to detect and help to monitor disease progression. And so vitiligo its monitoring can be very subjective based off of the morphology, the size, the distribution. All of these fine little areas of discernment can make it very difficult to track. And so the thought is that artificial intelligence and its subsets, machine learning and deep learning neural networks specifically, can be used to help make this more objective compared to the current clinical methodologies. And so the AI techniques that I'm talking about are classification, which is saying it's vitiligo or it's something else, be that healthy skin or another type of depigmentation disorder or another dermatologic condition in general, or detection, being able to actually just say, here's where the vitiligo lesions or lesions are on the skin. Regression-based modeling, which can be used to do lots of things, including classification, but also predict disease progression or treatment response. And then segmentation, which is being able to actually identify on an image where exactly the vitiligo lesions delineates. And so just for a small visual representation, here's sort of what I mean by classification. You can see vitiligo in the center on that top row versus something else. That's what classification does when some forms of regression do. And then we're looking at segmentation. This is what a visual representation of segmentation does. And so segmentation will allow you to actually say, here is how much vitiligo a patient has on their skin or on their whole body, depending on how the images are taken. And so the overall objective is to say, how can these four techniques be used to diagnose vitiligo as well as quantify disease extent? And so we, for our search strategy, searched across 5 databases, and we had a really large word search, including things like vitiligo and AI, but more extensive looking at techniques like PCA, support vector machines, coarse neural networks, and all of their subsets. For our inclusion criteria, we only included peer-reviewed papers that were only focused on image-based AI, so nothing looking at genes and things like that. But if they also included clinical based data as well as images, they were included. And they must have explicitly mentioned vitiligo. A lot of studies, when they're doing how well can machine learning look at detecting dermatologic diseases, they may include vitiligo in their image set, but they might not explicitly state that, and those were not included. And then for our exclusion criteria, anything like literature reviews, things that weren't AI-based, even if they were computational-based or algorithmic-based, were excluded. And then for our quality assessment, we use the Clear Derm guidelines, which is a 25-point guideline with overarching like 4 based categories that we use to sort of check our quality for the study. Overall, here are our results. We were able to include 54 studies in the paper, and 14 of these focused on image-based segmentation, and 41 of these focused on image-based classification, regression, detection. So specifically getting into the results. So when we're looking at the classification-based studies specifically, when we're talking about model accuracy, so how accurately can it say this is vitiligo versus something else, it overall on average performed an accuracy of about 83%. And so this did pretty well. It had a range of like 41% to 100%, but on average 82%. And then specifically breaking it down between like regular AI versus neural networks. Neural networks did perform slightly better. About 66% of the non-neural network-based studies had an accuracy of above 80%. In comparison to neural networks, 87% of these studies had an accuracy above 80%. And then the good stuff, when you're comparing it to how well did it perform compared to physicians, all of the studies actually performed equal to a physician or the expert that was mentioned in the study. Only one of the studies actually said that it performed slightly better than a dermatologist. Then looking at image-based segmentation type studies, they had an average accuracy of about 93%. So overall performing really well. And then it had an average DICE score of around 84%. And what a DICE means is that it's the ability for the AI model to predict its lesion segmentation, and then for that, or an overlapped image made by an expert to say, this is how ours align. it did 90% as well as how an expert would do. And so that's sort of what that means. So it performed about on an average 84% as well. And then when comparing it in a one-to-one comparison between experts, all of the studies that did this performed equally to an expert, be that a dermatologist or whoever was rating it. And so we can see that all of these models are overall performing really well, but when looking at how is the quality of these studies, I think that's also really important. And so a lot of these studies use private data sets, so data sets that we can't necessarily access, largely for security reasons. And so overall, there's a large lack of public vitiligo-based data sets for people to go and explore and validate the models that already exist. And there's a large lack of representation of diverse skin tones. A lot of the research is coming out of China and in Europe, so not very many diverse data sets. And then other things that the quality assessment kind of showed that it was lacking in was standardized imaging protocols and reporting skin tone information and external data sets. But overall, these models perform really well, and we can see that AI for vitiligo can perform equally to that of a dermatologist, but with the caveat, these models haven't been validated, and a lot of these models that have public images aren't clinical-based images. But there's still an opportunity for it to impact clinical workflows, to bring in a level of objectivity and to reduce clinicians' workloads. And in the future, larger, more publicly available data sets will definitely help to steer us in the right direction, as well as using newer technologies like explainable AI, using generative adversarial networks will also be able to help, I think, in the next space for AI with vitiligo. And then, of course, more standardizing imaging protocols. And limitations to the study include that all of the studies setups were very different in the way that they designed them. And so even though one study may be reporting an accuracy of 93% and another may be reporting an accuracy of 83%, those may not be a one-to-one comparison considering the design of the study. And that's everything I have. You can scan my references here. Thank you so much.